It's obviously been a tall task for cities and local health organizations to be able to roll things out for first and second doses. Now the task at hand is to try and get third doses to those in need and convince people to do so.
There are many more options available for people to get their third dose than were available when people first started getting vaccinated.
65,000 people in Toronto will be eligible for a third dose as of Monday, based on expanded eligibility announced by the province. As a result, 5 city-run immunization clinics are returning to a booked appointment-based system, with 40,000 spots available over the next 2 weeks.
I encourage you to book an appointment when you are eligible at a location that is most convenient for you.
Communities like Regent Park have local health organizations continuing to run immunization clinics in the neighborhood, something they vowed to try and continue for those in need of third shots and children when approved.
We'll look at making that available in the best way possible for community members. So that could look like expanding the hours of our clinic potentially, looking at setting up pop-ups if needed.
Education continues to be key, though. Some may become more hesitant. Convincing those to get more doses or shots for their kids is something Toronto Public Health has already vowed to do through town halls and webinars.
I think it's something very okay because as long as it is helping people to save their lives. It's not about arguing, it's about knowing that how are we saving our lives. If the government sees that's going to help the people, let them go on and do it.
You know, there's definitive evidence that for people who are immunocompromised and elderly people, the third dose can be very helpful. It can help with their immune system. So I think for those people, definitely they should get it.
More than 84% of people in Toronto have had 2 COVID shots as of now, something Mayor John Tory believes will have an impact on what's to come.
I think a lot of people who have had vaccinations over time of different kinds are quite used to the concept of a booster shot. They know that with regard to other kinds of injections they have on a routine basis. And I think what we're more likely to get, and this is where Dr. Davila is right, we're going to have the information available, is questions that relate to, as it has been the case before, what if I had one of these and one of those, and when did I have my last one, and how do I tell, and the kinds of questions that are very basic, not on the principle of whether you should get a booster shot.
This is a healthcare intervention. I think it's important that people feel that it's okay. It's more than okay. It's actually quite reasonable to raise questions and to actually engage in conversation around your unique circumstances and what your concerns are.
Now, Dr. Davila is also encouraging people to get their flu shots right now as well, saying those city-run clinics that will be opening to people who want those third dose COVID shots, they can get them both at the same time.